Good evening. I know you guys have enjoying some nice conversations over tea and sambusa. You couldn't get any better, right? Welcome, everybody. My name is Yusuf Abdi. I am the program director for Lutheran Social Service. I lead our Refugee Services Department. And I'm sure many of you are aware of what's happening with the new administration and changes to the Refugee Resettlement Program. And I'm not here for that this evening, so I have a lot of questions over that throughout the weekend and throughout the day. But I'm here, all of you, to welcome all of you here to Center for Changing Lives. We're very excited that you guys are here today. There's a lot of things lined up for you that I'm excited about. So first, I wanted to briefly share our partnership and our history with Isuroon and Lutheran Social Service. It's an interesting partnership. We have been working on it, and we've been talking about it for some time. But it's been great now this year that we are able to work with Isuroon. As you may be aware of, when new refugees come, when refugee arrivals come, there's a lot of need. And our focus as a resettlement agency, our focus is to provide the core services, the initial resettlement, during the initial resettlement period. So we are providing the housing and those other needs. But as there's many families who come with many needs as far as their health-related or maybe other community programs that they can take advantage of. And to have an organization like Isuroon, who have the experience in working in the health area for many refugees and immigrants and secondary refugees arriving, it's been really great to be able to partner with them so they can provide the proper education and cultural orientation that we need for our families to take advantage of some of the programs that are out there and some of the services that are out there. And also, especially the key important area for us is the area of education. They'll be able to do some workshops for our clients to learn some of the basic health literacy and learning and navigating some of the, try to get a doctor appointment, some of those basic things. And so it's been really great to finally implement this partnership and work with Isuroon. As a resettlement agencies, our focus is very short, like we work with the families the first few months in the United States, and that's not enough. So we are trying to expand that partnerships and work with many different community partners out there that are willing to provide additional support for families that are coming, whether they are primary resettlement cases or secondary cases that are coming to the United States. And Minnesota is a prime destination for a lot of secondary cases, so the need is very high. And even though resettlement numbers are going to be impacted in the near future, but still there are a significant number of individuals or refugees who are already arrived in Minnesota who will benefit this extended case management, especially the grant that Isuroon was able to provide under the self-help grant. And that's really good to be able to have individuals who have the experience in the cultural competencies in different areas. So I'm very excited this partnership, and we're looking at other ways to actually shift focus and priorities in the next couple of years to be able to work with other community partners to provide community integrations for refugees that have already been in the United States, already here in Minnesota, who will need that additional support in order for them to be self-sufficient and successful the proper way. So I'm not here to provide a lot more details in that area, but I'm here to welcome everybody to the Center for Changing Lives. And it's my honor to welcome Fartun Weli, who is the Executive Director of Isuroon, and she will share more about the work that they're providing. But welcome, everybody.
Thank you. Okay, I know everyone is tired, and on behalf of our Isuroon team, we want to thank you for coming. You probably wanted to go home and see your family, but you chose to be here today. We're going to get going and make sure that you're out of here 7:30. Usually we're good at that, making sure that we let you go as soon as possible. Many, many thanks to our staff, our volunteers. I don't know how I could have done this without them, so I don't want to take the credit, but they have done such a great job. We also have many, many guests, some of you that we know, some of you I don't, but I also want to thank Amir Adawi from Minnesota Department of Health, who's connecting to us and building leadership through the Minnesota Department of Health. Thanks to our Deputy Director of Minnesota Department of Health, Dan Pollack, is here to share with some experience and knowledge. The whole purpose tonight really is we know many issues are happening right now. Now what? We want to be able to come together and create solutions, co-create solutions. We're good at culture, understanding, research, but you also have many, many experiences that we want to tap into. So without further ado, I want to get going and just tell you a little bit about Isuroon, and then our program starts. So we already started, and we said welcome, and a little bit of Somali language. We said sodowo. We'll just have a little bit of Somali language later, and then breakout session. Just quickly, who really Isuroon is ethnic-led, ethnic-focused. Our priorities are set by the women and girls that we focus, and we're not bipartisan. We work with both parties, non-political groups. And our vision really, again, we are going through changes, and always, it comes down to helping the community, Somali women and girls, to help them themselves out of poverty, whether it's what our opportunities is. And our mission also, really, we're dedicated. We want to make sure that they're so amazingly driven and did a lot, and they want to do for themselves a lot. And so we just want to advocate with them, work with them. Again, it's about how do you become self-sufficient. We know new generation of immigrants, usually they're not really rich and they have a lot of challenges, but we also know that they're incredibly resilient, and they want to get opportunities to help themselves out of the poverty. Our focus areas, we do community-based participatory research, and the reason we do that is the communities on the driving seat, they're not subject. Out of that community-based participatory research, we develop health and wellness programs that are culturally specific, linguistically, and address all those authenticities that usually ethnic minority communities struggle. And we have, as Yusuf talked about, ethnic self-help grant, and we do case management. Our goal is to help Somali women who are new refugees to get the healthcare access need. And we'll talk about a little bit on advocacy and civic engagement and women and girl leadership. Challenges, we know what's happening right now, racism, social isolation, the low healthcare access. Somali women and many African immigrant women have a specific reproductive health care need, which we call a specialty, which is this female genital cutting, which most providers and a lot of people don't know. So we have a lot of maternal child health issues, trauma, and the focus is really the second generation or first generation. Programs that we do out of the research, health literacy. There's low literacy or high literacy or low literacy, whichever. Not understanding the system. There's the curative, where we came from, and preventative emphasis of here. And the other critical aspect of the challenges that health disparity exists really is the transactional system. Our healthcare system or any institution, it's all about come here, get going, I'm done within 15 minutes. But a lot of ethnic minorities, and even including Native Americans, African Americans, and even including us, you want that relationship, but ours is really critical. Do I trust you? If it's not, then good luck, I'm not gonna do anything, and we know where we end up, ER and chronic illnesses. We have ethnic food shelves, and we do culturally specific, again, food support because of the poverty rate of the Somali community and many other. Our strength, the reason we're really trusted is we always focus on the strength, never deficit. As soon as you talk about what you lack, that person is out of the game because we're looking at that. And mainly, our system, what we know is you have a language barrier, you're new, you're this and that, but we never tap into that incredible survival instinct and know-how that many refugees and people of color have. Again, we serve Somali women. This picture says a lot. We never forget her priority. We cannot really tell what's good for her kids because she comes from refugee camps, and probably she lost half of her kids. So the few kids she has, she knows what's best for them. All we're doing is giving the tools and supporting her. Trust is really key. That's why one of the reasons we're here is how do you build trust? It's a contract that we have with our members that we are constantly visiting and saying, goodness, have we broke this trust? It requires sometimes many tears, behind the scene conversations, many Somali tea, and making sure that that trust is being built, and one of the accomplishments that we have is really that trust has been going on, and really now it's very solid for us. We develop allies, again, many legislators, we build relationships, we call, and usually, whether it's a legislator or people who are in leadership, they are far away from where the community is, so what we do, we invite them in. A little bit weird, a little bit uncomfortable, people who don't speak the language, but coming in and you feel uncomfortable a little bit, but then later people will recognize you, and you can put face to the people you're talking about. It's not only data, there's information going on. We visit capital and public policy and advocacy we do. And as I said, I speak so fast because I'm trying to get to the time. The trust is really accomplished. Usually when our board, on our team, we talk about, we don't say how much money have we raised this year, it's how many people are keep coming back to us. And also, how many people are they bringing in? Hodun, who's our case manager for the Refugee Ethnic Self-Grant, she doesn't need any outreach. They're coming in because one good service that you do, you don't really need a marketing or outreach people. Their oral community, they'll bring them in. And financially, we're growing. Earlier, last year, it was only 2 of us. Now we're 8 of us. We're growing. And we have 2 new locations, St. Paul and St. Cloud. And our allies are also growing. One of the biggest challenges we had that we didn't have allies was that we did not want to change for the community. We want to keep the authenticity in. A project or an RFP grant, we did not want to partner. We really want to keep that, and there were a little bit of worry that if we just jump into a partnership, we would have lost the authenticity and who we really are. So, further do, or not do, we want to make sure that we focus on the commonality, and the differences always tore us apart because everyone wants to feel secure and empowered. But if we focus the commonality, I feel like we're going to get somewhere. And as many people say, whether it's a disparity or poverty or whatever challenges you're facing as a staff or as a community member, we don't see this as a project, it's a journey. And the journey requires coming together, having conversations, having difficult conversations, but making sure that that journey it stays. We have to go in and keep continuing. And